How to recognize vulva cancer symptoms. Although all women are at risk for cancer of the vulva, this disease is very rare. Despite the fact that few women will actually ever develop vulvar cancer, it's advisable to know and recognize the signs of it. If you find any symptoms, your doctor will need to confirm a diagnosis of vulvar cancer. Treatment for the disease is often successful, depending on its severity. Recognizing the symptoms of vulvar cancer. Identify potential symptoms. Vulvar cancer may not present any symptoms in its early stages, but some signs may be present. Identifying potential symptoms that you have can help you get a diagnosis and treatment as soon as possible. Symptoms or signs of vulvar cancer include unusual growths, itching or tenderness of the vulvar skin, and bleeding. 2. Pay attention to the health of your vulva over time so that you know what is normal for you and can easily identify any irregularities. 3. Be aware of your risk for vulvar cancer. The exact cause of vulvar cancer isn't known, but doctors know that certain factors and behaviors can increase your risk of getting vulvar cancer. Being aware of your risk for this disease can help you recognize it and get a diagnosis and treatment in a timely manner. Your risk increases with age, with the average age of diagnosis for vulvar cancer 65.5. Exposure to the sexually transmitted disease human papillomavirus, or HPV, can increase your risk of vulvar cancer. 6. Smokers may be at a higher risk for contracting vulvar cancer. 7. Having HIV will weaken your immune system and make you more susceptible to vulvar cancer. 8. A history of precancerous or skin conditions of the vulva, such as lichen sclerosis, can increase your risk of getting vulvar cancer. 9. Feel for lumps or other irregularities in your vulva. Lumps and other irregular growths can indicate vulvar cancer. Gently feeling your vulvar area with your fingers can help identify any unusual growths. Don't feel uncomfortable or self-conscious touching your vulva. You're not doing anything wrong and helping to protect your health. 11. Gently touch the various parts of your vulva to feel for any irregular growths or anomalies such as lumps or wart-like lesions. Make sure to feel inside of the labia as well. 12. It's a good idea to feel your vulva regularly so that you know what is normal for you. 13. See your doctor as soon as possible if you notice any of these symptoms. 14. Observe pain, itching, or bleeding. Pay attention to your body for any unusual or extended itching, burning, or bleeding. These symptoms can indicate vulvar cancer, especially if they don't go away. Watch for any lingering pain in your pelvic area, in particular when you urinate or have sex. 16. Look for any bleeding that is not related to a menstrual period, which can be a sign of vulvar cancer. 17. See your doctor as soon as possible if you observe any of these symptoms. 18. Examine your genitals. Vulvar cancer forms in vulva, which is made up by the external genitals of women including the clitoris, labia, vaginal opening, and any surrounding skin or tissue. Consider using a mirror to help you examine your vulva. Do regular exams of your vulvar skin so that you know what your vulva normally looks like and can easily identify any potential problems. 21. Look for changes in the appearance of your vulvar skin such as variation in color or skin thickness. Growths that look like a wart or an ulcer can also be a sign of vulvar cancer. 22. Vulva cancer occurs most often on the inner edges of the labia, which are the two folds of skin on the outer part of the female genitals. 23. You can also ask your longtime partner if they've noticed any changes in your vulva. He or she may notice differences more quickly than you do. 24. See your doctor as soon as possible if you observe any of these symptoms. 25.